Tonight,
It's the Auris Monarch Navigational Bronchoscopy system. The goal of it is to be able to get to spots in the lung that are farther deeper into the lungs than we previously would be able to get to.
an ABC 27 special presentation.
We want to be able to cure people with lung cancer and make it as simple as possible.
Lung Cancer, a Matter of Facts, sponsored by Penn State Cancer Institute.
Good evening, I'm Deborah Pinkerton. Tonight we're going to talk to the experts about lung cancer. We will learn about the prevention, detection, and treatment of this type of cancer. It's important to know that in the United States, lung cancer is the second most common cancer. In fact, it is the leading cause of cancer death. Doctors will answer some very important questions like, how is lung cancer detected? What are the latest treatment options? Can lung cancer be prevented? And if you have questions at home, Denise McCracken is here to tell you how to get them answered. Hi, Denise.
Yes, hi, Deborah. Dr. Henry Ostman, pulmonologist at Penn State Health Hampton and Holy Spirit Medical Centers, is answering your questions in a live web chat until 8 o'clock tonight. So to submit questions, go to abc27.com/lung, and I'll be back later in the show to share some of those questions with you. Deborah.
Thanks, Denise. Lung cancer is sometimes detected when patients are being treated for another illness. This was the case for a Dauphin County woman. Sarah Scholl shares Helen Kopp's story.
Helen Kopp of Harrisburg is a dog lover and active in her community.
I have a Maltese. She's a rescue. I got her in January. She's just a sweetheart. And I'm involved in a lot of stuff. I do Meals on Wheels. I'm a Stephen minister. I'm in the Daughters of the King.
Early last year, Helen experienced frequent urinary tract infections, which led her to seek medical help.
They sent me for a CT scan of my kidneys. And when the CT scan went back to the urologist is when the nodule was in my lung. So they suggested that I see a pulmonary doctor.
That doctor was Brian Hirsch, a pulmonologist with Penn State Health.
When we did another follow-up of her scan in February of this year, the size of the nodule significantly grew. And that was a big warning sign that something potentially bad could be occurring.
I thought, boy, I hope it isn't cancer, but it was. And that was a shock. I mean, you think about that, but when they really tell you that, it's like it just stops you in your tracks.
She had a adenocarcinoma of the right lower lobe, and it was a stage 1A2, which is still considered to be an early stage cancer.
So they said that I should have it removed, and I agreed with them.
I referred her to Dr. Reed for surgical removal of that spot that was growing, especially because there was no good way for us to get to it really any other way with any of the tools that we have available.
Our thoracic surgery team performs most operations in the chest using robotics. The advantage to it is small incisions, which hurt less. There's also incredible dexterity and great visualization. So it really is the contemporary best approach to many lung cancer operations. The key aspect of the operation is to take out the lobe in which the tumor is located, and that's what we did, along with removal of lymph nodes.
Helen's surgery was a success. She spent a few days in the hospital.
She did very well during the surgery, and her post-operative course was really uneventful. Despite having had major heart surgery only a few months before that, she was out of the hospital in 4 days and has made steady improvement.
Helen is thankful the lung cancer was discovered early.
She was incredibly optimistic and motivated. And really, I always make the point to patients and their families that we tend to underestimate how important motivation is in going through an operation and, importantly, their recovery.
I feel lucky. There's a lot of people out there that aren't as lucky as I was. And I know a few of them. So I feel blessed.
Thank you, Sarah, for that report. Helen feels very fortunate. She's celebrating 1 year of being cancer-free. Congratulations. And joining us now is Dr. Michael Reed, Chief of the Division of Thoracic Surgery at Penn State Health, and also Helen Surgeon. Thanks for being with us.
My pleasure.
Helen is really doing great, and she's, as we mentioned, celebrating that 1 year cancer-free anniversary. She visited the hospital today, had a good checkup. Tell us, how common is it to find lung cancer when patients are actually in the hospital being treated for something else?
It's actually very common that we find early lung cancers when we're not looking for it. We're getting a CT scan for other reasons. CT scans are performed very frequently, and we'll catch these tumors occasionally early when they're very treatable. In fact, this early detection and the good results prompted studies that proved the benefit of lung cancer screening for patients who are at risk.
Wow, that's certainly great news. Why don't we talk about some of the different surgical options to treat lung cancer?
So the key for surgery, which is used for early stage lung cancer, when it's caught early before it's spread, is to get the tumor out as well as lymph nodes. The extent of the surgery depends on the location and the size of the tumor itself.
And talk about the surgical options as far as using robotic surgery. Does that play a major role in lung cancer surgery?
It really is the primary approach for most operations now. Robotics are used to have less invasive approaches, not the traditional big incisions. By using small incisions, as well as this great visualization, patients recover quicker. They have less pain, and they do better.
And hospital stays, I'm sure, shorter as well.
Less time in the hospital and resumption of activities. Getting up and around the house, getting back to work, getting back to school, all occurs much more rapidly if a person has a minimally invasive operation, particularly robotic surgery.
Yeah, technology is truly amazing. Now, in recent years, we have seen more treatment options and better prognosis for patients when lung cancer is detected early. Talk to us about that.
Well, the key is catching cancer before it's spread. That really improves the prognosis. It also allows a less invasive operation, so people do better when you catch cancers early.
And why don't we talk about research? Research plays such an important role in finding new ways to treat lung cancer patients.
Sure, with lung cancer, as well as really all cancers, we attack it on many fronts. We want to catch it early. Of course, we want to prevent it. We want to have improvements in diagnosis and staging, and then, of course, improvements in treatment, and that depends on research. There is research into better operations through advanced technology, research into more precise radiation therapy, and the medical therapy for cancer, particularly lung cancer. It's not one size fits all. And we're improving in chemotherapy, immunotherapy, targeted therapy, so that treatment for cancer is more and more individualized.
Yeah, and that's really important, and patients certainly want to know that. Dr. Reed, thank you so much. Lots of really good information tonight.
Thank you.
If you would like more information on the treatment and care for lung cancer patients at Penn State Health, you can visit online at pennstatehealth.org. Now let's check in with Denise McCracken. What are some of the questions being asked tonight, Denise?
Thanks, Deborah. We have a wide range of questions coming into the web chat. Dr. Henry Ostman, pulmonologist at Penn State Health, Hampton, and Holy Spirit Medical Centers, has been busy this evening. Thank you so much for joining us. So our first viewer question is, what are the signs and symptoms of lung cancer?
So the signs and symptoms are typically a new cough that just won't go away. Coughing up blood is also a concern, hoarse voice. Other symptoms can include back pain. They can include voice changes, weight loss, permanent appetite changes.
And our next viewer says, I have known people who never smoked a day in their lives but still had lung cancer. What are some other causes?
It's true. Other causes can include occupational asbestos exposure and radon in the home. burning wood or coal in the home or in buildings was commonplace before, but still common in other parts of the world. Those are risk factors. But the chief risk factor is smoking. Smoking can include pipes and cigars in addition to cigarettes. Primary smoking obviously is the big concern, but secondhand smoke is also a concern too.
That's a lot of great information. Thank you
Yeah.
so much. We're going to check back with you a little later in the show as well. And if you have a question for Dr. Ostman, go to abc27.com/lung and submit your questions. Back to you, Deborah.
Thanks, Denise. Coming up next, learn about the latest technology Penn State Health Hampton Medical Center uses to detect lung cancer earlier so patients can get the help they need to live the way they want. Stay with us. We will be right back.
You're watching Lung Cancer, A Matter of Facts on ABC 27, sponsored by Penn State Cancer Institute.
Welcome back. Penn State Health Hampton Medical Center just celebrated its one-year anniversary. The team is determined to give patients the help they need so they can live the way they want. Take a look. Penn State Health Hampton Medical Center is one of a kind in Cumberland County. The team uses the latest technology to treat patients. The Monarch robotic-assisted bronchoscopy is the latest tool.
It's a robotic bronchoscope. Basically, it's human-controlled, but it has robotic arms for really good precision and for the ability to really detect fine movements and move smoothly throughout the lungs.
Dr. Christopher Schaefer shows us how the high-tech equipment works.
It's controlled by a controller. It almost looks like a video game controller that controls the robotic arms, and through your own input using that controller is how you control the camera to go down through the breathing tube and out into the lungs, and you're able to get out to the target.
The pathway to the target or suspicious area is mapped out for the doctors.
We create a GPS program based on the patient's CAT scan, so we know exactly where to go, which turn to make. It is very similar to GPS type of technology, but there's a lot of different tools and features on the camera that allows us to make sure that we're going to the right spot. It tells us where to turn, take this angle.
The team has used the Monarch system since May, and there is one goal.
We want to be able to get to the small targets that are out there that might be farther out that are easier to treat, easier to take care of, easier to cure, and we want to find them early. The goal ultimately is trying to cure as many people of lung cancer as we can and trying to do it in the safest way possible and the best experience and the least complications.
Certainly great news for patients. The procedure takes between 1 to 2 hours. And joining us now is Dr. Christopher Schaefer, pulmonologist at Penn State Health Hampton Medical Center. This technology is truly amazing. Why don't you talk to us about really how it benefits patients?
Yeah, it is great. It's able to allow us to get farther out into the lungs for smaller spots than we otherwise would have been able to go after. It's really allowing us to do more cases bronchoscopically to get a diagnosis, to do the biopsies. And we prefer to do them bronchoscopically to help minimize complications like pneumothorax, which are more likely with the other non-bronchoscopic versions of biopsies. Also, in terms of doing them bronchoscopically, that allows us to sample the lymph nodes as well as the primary spot that we're going after. So it kind of allows for some one-stop shopping to get all those answers all in one procedure, as opposed to having the person undergo multiple procedures to get that information.
Sure, so you can really look at the entire area and you don't have to go back for another procedure, correct?
Exactly.
That's certainly good news. Now, as we've heard, detecting lung cancer early is really the key. Who should be screened for lung cancer and why?
So we follow the United States Preventive Service Task Force. Their recommendations, they have 3 criteria that we follow to decide who qualifies for low-dose lung cancer screening. And really those 3 criteria are: number 1, age, so age between 50 and 80. Number 2 is if someone's currently smoking or if they quit smoking within the last 15 years. And criteria number 3 depends on how much they had smoked. So if somebody had smoked the equivalent of a pack a day for 20 years, we call that 20 pack years. If they smoke that much or more and they meet the age criteria and they are currently smoking or quit within the last 15 years, they qualify for low-dose lung cancer screening.
Okay. Now, as far as the Monarch is concerned, you've been using this technology for some time now. Talk to us about the feedback that you are getting, say, from patients and also the providers.
It's been overwhelmingly positive from both. From the patient's perspective, when they're faced with a possible diagnosis of lung cancer, they want the best tools to help get the diagnosis or figure out what's going on. They want a timely and accurate diagnosis, and this technology allows us to do that and allows them to get it close to home here in the West Shore. Further, in terms of the physicians in the area, they've had similar feedback. They're happy with the timely and accurate diagnosis. For instance, I can think offhand of 2 patients who had prior bronchoscopies before we had the Monarch with the previous version of the technology, who were not able to get a diagnosis from that version of the technology. And then we got Monarch, and their physicians called me up and said, hey, do you think we could do a Monarch case on these patients? And fortunately, we were able to get diagnoses, prove that the spots we were going after were cancer in both of those patients, so they can move forward with treatment.
Yeah, that is great news for them. Now, Penn State Health is expanding, and so have the pulmonary services expanded to both Hampton and Holy Spirit Medical Centers. Talk to us about that.
Yeah, so my group joined Penn State Health about 3 years ago. Holy Spirit joined Penn State Health about 2 years ago, and of course Hampton opened last year. That's multiple locations over on the West Shore, over in Cumberland County. Really expands access to everybody. It's nice to have them all in one network. And as you know, with lung cancer and possible lung cancer, there are a lot of medical tasks to do, a lot of tests that might need to be done, CAT scans, sometimes MRIs, PET scans, breathing function tests, labs, and having all these locations in the network allows people to get the test done close to home. It's easier, quicker, more efficient for them, and less to worry about. And of course, the bronchoscopies can be done at both of those hospitals. Robotic bronchoscopy is only done at Hampden, but both hospitals are able to do ultrasound-guided bronchoscopies and traditional bronchoscopies.
Okay, Dr. Schaefer, lots of really good information tonight. Thanks for filling us in.
Yeah, thanks for having us.
And if you would like more information on the treatment and care of lung cancer patients at Penn State Health, visit online at pennstatehealth.org. Now let's check in with Denise and get more answers to our web chat questions. Denise.
Thanks, Deborah. Lots of great questions coming in tonight. We've received just over a dozen so far. And back with us is Dr. Henry Ostman, pulmonologist at Penn State Health Hampton and Holy Spirit Medical Centers. Our next viewer asks, are all lung nodules cancerous?
The vast majority of nodules are not cancer. They typically represent something that's benign, such as an old healed infection or remnants of an infection. They might have calcifications or a calcium shell on the middle or on the outside. Rheumatoid disease can also cause nodules in the lungs, so can a condition called sarcoid. So the vast majority are probably not tumors.
Okay, and our next viewer asks, how can you lower your risk of lung cancer?
Well, smoking is probably the biggest risk factor, as COPD is also an independent risk factor. So treating COPD and quitting smoking, early quitting, permanent quitting, smoking cigarettes is probably the best thing you can do. Other things that can be done for non-smokers are reducing radon in the home, on-the-job exposure to asbestos, reducing that, and reducing your exposure to pollution particles in the air.
Lots of excellent information.
Yes.
Our next viewer asks, with other respiratory illnesses going around right now, how can you know the difference between lung cancer and then other illnesses?
Sure. So typically, X-ray and CAT scan findings do not look the same for malignancy as they do for non-malignant conditions. Things like bronchitis, viral respiratory infections, and pneumonia will not be linked to weight loss and coughing up blood and permanent appetite changes and duration of cough, a cough that won't go away, is typically not seen in non-cancerous conditions.
Great, you've given us a lot of excellent information. Thank you so much for joining us. Now I know you're here until 8 o'clock, so
Yes.
There is still time for you to get your questions in. Go to abc27.com/lung to submit your question. Back to you, Deborah.
Thank you, Denise. Now joining us is Dr. Jennifer Toth, Director of Interventional Pulmonary at Penn State Health Milton S. Hershey Medical Center. Thanks for being with us.
Thanks for having me.
So Dr. Schaefer was talking to us about the Monarch technology,
Yes.
and now we're learning that that technology will also be available at the Penn State Cancer Institute in Hershey. Talk to us about that.
Yes, we're very excited to join our community colleagues in having the Monarch system for not only early diagnosis of lung cancer, but also we anticipate being involved in clinical trials for treatment options such as ablation or intratumoral injection of chemotherapy. So we're very excited to offer that service as well.
Yeah, that is exciting. Now, Penn State Health, you all work together to discuss the patients, to really personalize treatment, and Dr. Reed really touched on that as well. How does that benefit a patient?
Patients love it. It's like getting 5 consults in one. We have a multidisciplinary clinic that includes our interventional pulmonology, thoracic radiology, medical oncology, surgery, and radiation oncology. So a patient's docs, we all communicate with one another and we all discuss the patients in a multidisciplinary conference. So everybody's on the same page and knows the patient's treatment course. We can troubleshoot, talk about issues that they're having and refer them to the correct specialty.
And really, how has that changed over the years, would you say?
I think it's developed from silos where a patient would see an oncologist but have an issue that needed to be taken care of by a pulmonologist or a surgeon. And that referral would then take several days to weeks, then kind of down the line. Whereas now, with all of us in one system, you know, our community hospital as well, we can all help and band together to take care of these patients the best that we can. It's clearly the best model.
Yeah, so really very reassuring for a patient to know that everyone is working together and for that one goal of curing them.
Yep.
Absolutely wonderful. So technology is also something that's amazing. That has come a long way. How can detecting lung cancer in a minimally invasive way really help decrease the time as far as diagnosis to treatment?
Minimally invasive techniques allow for a very shorter recovery period, so you can move to the next logical step in a faster way. So the diagnosis, we can do you know, tumor sampling as well as the lymph nodes in the middle of the chest at the same sitting. We can present that to our surgeons, and then we send them in the direction that is most appropriate.
Now, we have heard as far as detecting this early lung cancer early, I guess the big question is, can you prevent lung cancer?
You can try to modify lifestyle factors. Smoking obviously is the biggest one. So by not smoking, using respiratory protection in high, as Dr. Ostman had mentioned, high pollution areas, asbestos exposure. Radon is also, it's the #1 cause of lung cancer in non-smokers. So having your home radon tested, as Pennsylvania and central Pennsylvania has a very high radon rate, will also help to prevent complications.
Oh, that is certainly good information, good for our viewers to know that. Talk to us about COVID. Has that really, have you seen an increase in cases because of COVID or a decrease?
COVID, unfortunately, given the isolation and the fear that it caused patients to not want to, come out and go to their doctors, we have unfortunately seen an increase after COVID of lung cancer cases that are in a higher stage. So some that may have been detected earlier, which now have advanced. So it's important now, as restrictions have lifted, to go get your screening and see your doctor, and if something's just not right, get it checked out.
Yeah, that's what I was going to say. What really is the most important thing for people to know? What is the message that you want to give to our viewers tonight?
Screening saves lives, and lung cancer is the #1 killer of cancer killer of people. And really, you know, the studies that have been done, lung cancer screening really does save lives.
And go to your doctor on a regular basis as well. And if something doesn't feel right, get it checked out. Dr. Toth, thanks so much for joining us. Lots of good information tonight.
Thanks a lot.
And we also send a special thanks to Helen for sharing her story, and you, our viewers, for sending in your questions. If you would like more information on lung cancer treatment and care at Penn State Health, visit online at pennstatehealth.org. And join us for our special, The Gift of Good Health, next Wednesday evening, December 7th at 7:30. Experts from Penn State Health will reflect back on an amazing year of caring for patients. You will meet 3 local brothers who are giving back after they all received heart transplants after being diagnosed with a hereditary condition. You do not want to miss this heartwarming special 1 week from tonight. That's December 7th at 7:30 right here on ABC 27. We want to thank you for watching tonight, and we wish you good health.